Hello everyone, Professor Big here. In this lecture, we are going to discuss fluid and electrolyte imbalances and how they affect our body, right? And acid-base management, there's another PowerPoint for it. We will talk a lot more about that in that one. Please go ahead and fill out your guided notes, look at your key points in your module, complete your assigned readings. Those will all help you understand this topic even more. Okay, these are the learning objectives for this lesson. Let's talk about homeostasis. What is homeostasis? Homeostasis basically refers to the body's ability to maintain a stable internal environment despite changes occurring both outside and inside the body. I mean, we can't always expect everything around us or inside us to stay stable, right? But homeostasis is basically our body's ability to maintain it that way. For example, if you're going outside and it's 120 degrees outside, right? I mean, we can't control that, right? Other than just sitting inside the house and maintaining the house temperature, the same temperature that your body's temperature is. But changes are going to happen. Homeostasis is basically the body's ability to maintain proper body functioning and a stable environment inside. Okay, to keep the cells functioning properly, the body carefully regulates fluid volume, electrolyte compensation, and osmolality within very narrow limits. Even small disruptions can interfere with normal cellular function and can lead to severe illness. So the body is continuously adapting through various mechanisms to maintain this balance. For example, if your fluid volume decreases, the body activates the thirst mechanism and the hormone response, which will conserve water. If electrolytes become abnormal, the kidneys will work to restore normal levels, right? Maintaining homeostasis is extremely important for survival because every organ system inside our body depends on a stable environment. Okay, how is this homeostasis maintained? Homeostasis depends on maintaining the balance of fluids, electrolytes, volume in the body, right? And so fluid movement is driven by concentration gradients and pressure gradients. Water and electrolytes naturally move from areas of higher concentration to lower concentration, while different pressures help push or pull fluid between these compartments because that's how fluids shift and we maintain that stable environment. Several systems help to regulate this process. The kidneys are the primary regulators, right, of this, process because they adjust urine output and electrolyte excretion. Hormones such as ADH, antidiuretic hormone, and aldosterone also help conserve or remove water and sodium when needed. The thirst mechanism helps the body maintain balance by encouraging fluid intake. When the body senses dehydration and increased osmolality, you're going to start feeling thirsty, and this basically helps you survive. Okay, so let's look at the three pillars of internal balance. We love homeostasis, we want it to stay, and how we are going to make sure it stays through these three pillars of internal balance. Fluids, right? The foundational solvent, accounting for 50 to 60% of the body's weight, adult body weight. Electrolytes, the charged particle that govern the osmolality and nerve impulses. And then acid base, the precise regulation of hydrogen ions to maintain a strict pH window of 7.35 to 7.45. So let's talk about fluid volume because we said fluid, electrolytes, and acid bases help us maintain this. So let's talk about fluid volume. Most of the body is composed of water, and the water is divided into compartments. About 2/3 of the body water is intracellular, that means inside the cell, and the other 1/3 is extracellular, that means outside the cell. The extracellular compartment is divided into interstitial. Now we're talking about the fluid that's outside the cell. This is divided into interstitial fluid, the fluid between the tissues which surrounds the cells, intravascular fluid, which is the plasma in the blood vessels. The plasma surrounds each red blood cell, and additional compartments including lymph and transcellular fluid. Transcellular fluid is, for example, cerebrospinal fluid, pleural fluid, fluid in the GI tract and the joints, like your synovial fluid. All of this is transcellular fluid. Okay, understanding these compartments is important because we need to understand fluid shifts between them because it can affect blood pressure, circulation, and cellular function. So we need to have the right amount of fluid in the right spaces with the right electrical charge. Okay, body water content varies based on age, gender, body composition. Individuals with greater lean body mass have higher percentage of body water because muscle tissue contains more water than fat tissue. See, it's always good to have more muscle than fat, right? Women and older adults generally have less body fat, and so they have less body water, right? Because they have, not less body fat, they have lower lean body mass and a higher fat composition, and so they're going to have less body water. This is clinically important because older adults are at a greater risk for dehydration and fluid imbalances. It's also important to understand that changes in body weight often reflect fluid changes. For example, 1 liter fluid, 1 liter water equals approximately 1 kg. So if a patient gains, 2 pounds in one day, this may represent 1 liter of fluid because 2.2 pounds is 1 kg. Let's talk about electrolyte composition now. We have a lot of different electrolytes in our body, right? They're substances. What are these electrolytes? They're basically substances that separate into electrically charged particles called ions when dissolved in water. They play essential roles. And why are we worried about being dissolved in water? Because body water, right? The fluid in our body. They get dissolved in the body water and they have electrical charges. They play essential roles in what? Maintaining fluid balance, nerve conduction, muscle contraction, and acid-base balance. Positively charged ions, the cations, include sodium, potassium, calcium, magnesium. Negatively charged ions are called anions. Anions. I'm sorry, I can never pronounce this word. And these include bicarb, chloride, and phosphate. So now electrolyte concentrations differ between intracellular and extracellular compartments. Potassium is a major intracellular cation, while sodium is a major extracellular one. So this difference in electrolyte distribution is critical for normal cellular function and electrical activity because potassium, there's a reason why it's intracellular because it does its job inside the cell. Sodium is extracellular. It has a role outside the cell. So now when that role switches and you have electrolytes in places where they're not supposed to be, you're going to have imbalances. So electrolyte balance is very closely connected to body water content. So for example, age, gender, body composition influence how much water and electrolytes the body contains. Because older adults have less body water, they are more vulnerable to dehydration and electrolyte disturbances. It's important to remember, though, that changes in fluid volume often affect electrolyte concentrations. So a patient who loses fluid through, for example, taking diuretics or vomiting or diarrhea may also lose important electrolytes like sodium and potassium. Here, this is a cheat sheet on some of the cations. For example, the major ones, sodium and potassium. Remember, sodium, think neuro and water balance. Potassium, think cardiac and muscle function. So when you look at the signs and symptoms of imbalances in potassium or sodium, they would be based on what they affect. For example, sodium, neuro and water balance. So signs and symptoms would include neurological symptoms, for example, agitation, restlessness, thirst, neuromuscular activity, lethargy, and dangerous signs and symptoms, are seizures, coma, cerebral edema. Now, when you look at potassium, right, it's cardiac and muscular function. And so if it's hypokalemia, less than normal potassium, then you're going to have ECG changes, right? Cardiac changes, muscle weakness, muscle changes, hyporeflexia. If you have too much potassium, it's also going to cause arrhythmias, for example, peaked T waves, big one for hyperkalemia, right? And what can happen? Biggest thing, worst thing that can happen is a cardiac arrest and death, right? So it's important to know, the signs and symptoms that are associated with each of these electrolytes. Let's look at other electrolytes such as calcium, magnesium, phosphorus. Calcium, remember, calcium calms, right? So when you have too much calcium, you are too calm, you are in a coma, right? When you have too little calcium, you're going to be the opposite. You're not going to be calm, so you're going to be hyperactive. So if you look at signs and symptoms when you have hypocalcemia, too low calcium, excitability, smooth muscle spasms, right? Hypercalcemia, too much calcium, then you're too calm. Lethargy, decreased deep tendon reflexes, bradycardia, you're breathing slow. Eventually, you can end up with a coma, right? And the hallmark signs of hypocalcemia and hypomagnesemia are, the Chvostek signs, Trousseau, and the Chvostek sign right here. Chvostek sign, when you tap on the cheek, it twitches, right? You don't have enough calcium, and so you're twitchy. Like if you put the blood pressure cuff on, you'll see the person's hand turning inwards. Magnesium is very similar to calcium. Like we said, calcium calms, magnesium also calms. That's why people take calcium magnesium to help them sleep so they can feel calm. When pregnant women are in preterm labor and doctors want to stop their early contractions, they give them magnesium IV to calm the smooth muscles of the uterus, right? So when you have too low magnesium, hypomagnesemia, then what's going to happen? You're going to be hyperactive. When you have too much magnesium, then you're going to be the opposite, and you can end up with paralysis and respiratory arrest because you're too calm, because it affects your soft muscle like your lungs and your uterus and things like that. Phosphorus is, normal is 2.5 to 4.5. It maintains an inverse relationship with calcium. For example, if calcium is high, phosphorus will be low. Calcium is low, phosphorus will be high. So here are the signs and symptoms for phosphorus imbalances. Fluid movement. We talked about how fluids maintain a stable environment, homeostasis and electrolytes. These are both very important. You don't want too little or too much of it, right? So, and we said that homeostasis is maintained through the shifts in fluid from different compartments. We talked about how fluid lives in certain compartments, the intracellular, extracellular, if it's extracellular, where do they live? Now we're going to talk about how it moves through these compartments. So the fluid and electrolytes basically move through the body using several processes. Passive processes that don't require energy. Diffusion, for example, is the movement of molecules from higher concentration to low concentration. Facilitated diffusion is similar, but it requires carrier proteins. It still doesn't need energy, but it needs the carrier proteins to help move larger molecules across the membrane. Osmosis refers specifically to water movement. Water moves towards the area with a higher solute concentration to equalize concentrations on both sides of the membrane. Active transport requires energy in the form of ATP. A common example of this is the sodium-potassium pump, which moves sodium out of the cell and potassium into the cell against their concentration gradient. So passive processes basically, for example, diffusion, basically water and solute moves from high concentration to low concentration. Facilitated diffusion, it uses carrier proteins because proteins love to bind. And so then you have osmosis, where water moves from higher solute concentrations to lower. Okay, active process, you need ATP. It needs energy. It moves substances against the gradient, right? So it's not easily just moving from higher to lower because of the pressure, right? Basically you're moving against high pressures. And so that's where you need the energy to move against high pressures. It's like telling somebody to lift up a weight that's like, for example, I know it's a bad example, but telling somebody to walk through, for example, a thin curtain as opposed to walking through a wall, right? I mean, you need more energy to walk through a wall. You're going to have to probably break it. So basically that is your sodium-potassium pump. Okay. Osmosis, the movement of water from area of lower solute concentration to an area of higher solute concentration. The pulling force created by these solutes is called osmotic pressure. The greater the concentration of solutes, the stronger the pull on water. So the more solutes you have in the fluid, it's going to create a greater osmotic pressure and it's going to pull more water in, right? Remember osmosis, movement of water from area of lower concentration to higher concentration. So more, if there's more concentration, then it's going to pull more. Osmolality measures the concentration of dissolved particles in body fluids, and it's an important indicator of hydration status. So normal plasma osmolality ranges from 280 to 295. Higher values suggest water deficit or dehydration. Lower numbers suggest excess water because now your body water is more, your plasma is more dilute. Okay, so urine osmolality changes based on hydration status. So kidneys, based on hydration status, kidney function, and your antidiuretic hormone levels. That's what urine osmolality is based on. So let's look at an example. The osmolality albumin example. Albumin is a great example of osmotic pressure. So when albumin is administered via IV to patients, it increases osmotic pressure in the vascular space. So vascular space means inside your vascular system, like your veins and your arteries, right? So now when you have albumin in there, now you're increasing the osmotic pressure inside the veins. So what's going to happen to the water that's around the vascular system, around the veins and the interstitial spaces and all those spaces? What's going to happen? It's going to get pulled in, right? So the water is going to get pulled in from around the vessels, your arteries and veins, inside the arteries and veins. And so now you're reducing the edema around the arteries and the veins. So this is an important principle when treating patients with low blood pressure or severe edema. So if they have low blood pressure, we want the fluid inside their arteries and veins to increase that blood pressure. We want to get rid of the edema if they have severe edema, heart failure patients, for example. You want to get all that fluid out from around your tissues into the vascular system, so your body, it can increase the blood pressure and you can reduce the edema. Okay, so let's look at how to calculate osmolality. I mean, you don't really need to know this that much, but it's good to know, that osmolality is estimated using sodium, glucose, and BUN levels, right? It shows, the concentration of the fluids in our body. Okay, so you can review this and kind of look at it. It's nice to know these things. Okay, so how does osmolality affect fluid movement? Because remember, we said increased osmolality means increased osmotic pressure, because that's what albumin does, right? We give albumin and we increase the osmolality, the osmotic pressure inside the vessels, and so it pulls the water in. So now, the types of solutions based on osmolality are isotonic, hypotonic, and hypertonic. They're different solutions, okay? Hypotonic solution. The extracellular fluid, this is the fluid around the cell, has a lower solute concentration than inside the cell. So what happens when that's the case? Water will move into the cell, okay? Because the extracellular fluid has lower concentration, it's going to move towards the higher concentration that's inside the cell. And so water will move inside the cell. And then if you have too much water moving in, fluid moving inside the cell, it can swell and possibly burst. That is your hypotonic solution. In isotonic solution, the osmolality inside and outside the cell is the same. So there is no movement of water in isotonic solutions. Okay? Equal inside and outside the cell. It remains normal. Now, in the hypertonic solutions, what happens? The osmolality in the hypertonic solution, the extracellular fluid has a higher solute concentration. So remember, water is going to go from lower to higher. So the water inside the cell will come out and it's going to go outside because it's going towards a higher concentration. And so when that happens, the cells can shrink and could die because cells need water. Okay, hydrostatic. Another concept you need to understand is hydrostatic and oncotic pressures. Now, when when you're thinking of hydrostatic and oncotic pressures, you got to think like of how the cardiovascular system, your vascular system, maintains volume, fluid balance with these pressures, right? Like think of it all together, your cardiovascular system and these concepts. Okay, so hydrostatic and oncotic pressures are the major forces that control fluid movement between the vascular and the interstitial spaces. So you have fluid inside your vessels, your arteries, veins, capillaries, and then you have fluid outside those vessels in your interstitial spaces, right, in between the cells and stuff. So hydrostatic pressure is the force of fluid pushing against a vessel wall. So in blood vessels, this is essentially blood pressure, right, inside your blood vessels. When you're measuring somebody's blood pressure, that's what blood pressure is. It pushes water out of the capillaries into the tissues. Hydrostatic pushes, oncotic pressure pulls. So oncotic pressure is created mainly by plasma proteins, because remember now proteins love to bind, right? So they're going to pull, such as albumin. Like even the albumin example we went over, this pressure pulls water back into the vascular space. So this balance between these pressures is necessary to prevent edema and maintain the circulation. Please read over this and and read the extra information in your assigned readings, because this will help you really understand this concept good. So let's talk about capillary fluid movement. Okay, so when your body, your heart is circulating blood throughout your body to perfuse the body, it is providing oxygen, nutrients to the tissues. How is it doing that? Because if you think of it, your veins and your arteries and your capillaries are all very different. Arteries are high pressure, thick walls, right? High pressure. Capillaries are very thin, permeable. That means fluid can go in and out. And then veins are not as thick and high pressure as arteries, because because the veins, what their job is to pull in the fluid so it can return it back to the heart to circulate again, right? So each of them has a role, right? And this is where fluid exchange, the fluid movement comes into play, the hydrostatic and the oncotic pressure. So at the arterial end of the capillaries, so you have your arteries, then your capillaries, and then your veins. Arteries send high pressure, fluid, blood from the heart into the capillaries. It becomes lower pressure. Then at the capillary level, it's going to distribute to the organs and the tissues. It distributes what? Nutrients, oxygen, all those things to the tissues. And then your veins are going to collect all the volume and take it back to the heart so it can recycle it, right? So this is happening all day, every minute in our body, right? So now at the arterial end of the capillary, at the arterial level, hydrostatic pressure is greater. So the fluid moves out into the tissues. So now we're looking at in the capillaries, the hydrostatic pressure is greater. So it's going to push it out. It's pushing out the nutrients and all of those things that, the organs and the tissues need. At the venous end, once that's moved out into the tissues and it gives it the nutrients, at the venous end, the oncotic pressure becomes stronger, because now what the job of the venous system is to pull that fluid back into the capillary, right? All the toxins, everything like that, pull all that fluid back into the capillaries and bring it back to the heart. So the oncotic pressure is higher in the venous system. So these fluids basically, why do they shift? Fluid moves across the capillaries, and all of this movement depends on four major pressures: capillary hydrostatic pressure, plasma oncotic pressure, interstitial hydrostatic pressure, and interstitial oncotic pressure. At the arterial end, as we mentioned, hydrostatic pressure is greater, and in the venous end, we mentioned the oncotic pressure is greater. So fluid shift can go from interstitial places to plasma, from the plasma, your blood, to interstitial spaces, right? So when this happens, edema occurs. Basically, out of your vascular system into the tissues, you're going to have edema, right? Because there's going to be fluid outside into the tissues. So But this is increased venous hydrostatic pressure is one common cause of this and can occur with heart failure, fluid overload, venous obstruction. Patients with heart failure, you're going to see that they have a lot of edema, right? And that is because their venous hydrostatic pressure is increased. So instead of the venous system pulling in the fluid back into the venous system to take it to the heart, the venous system's hydrostatic pressure is high, and so it's pushing the fluid back out into the tissues instead of pulling it in. Okay, and low plasma protein levels can also cause this. Why? Because protein loves to bind, right? And protein has high oncotic pressure. So now, if you don't have enough plasma proteins, right, you don't have enough proteins in your blood, this decreases that pull pressure, the oncotic pressure, which pulls the fluid back in. So without enough albumin, fluid cannot be effectively pulled back into the bloodstream. Damage to the capillary walls from burns, trauma, or inflammation can allow proteins to leak into the interstitial spaces, and that further draws fluid into the tissues. Because why? Because remember, fluid goes from low concentration to high concentration. So if the plasma proteins are being spilled out into the interstitial spaces, fluid is going to follow it, and it's going to come out of the vascular system into the interstitial spaces. Here is the fluid shift where it goes from the interstitial spaces to the plasma space. Increased plasma on osmotic oncotic pressure to increase interstitial hydrostatic pressure. Fluid can also shift back into the vascular system when plasma osmotic pressure is increases. So when you have a lot of pressure inside the vessels, then it's going to pull the water back in. This will occur when you have substances like albumin, mannitol, or hypertonic solutions that are administered to patients. Like, for another example of that is compression stockings, right? When somebody wears compression stockings, what happens? The pressure on the interstitial spaces by compressing them pushes the fluid back into the circulation and reduces edema, and that's why we wear them, right? To reduce the edema. Okay, causes of imbalances. Fluid and electrolyte imbalances can result from illness, injury, medications, or medical treatments. Conditions like burns and heart failure can disrupt homeostasis, while treatments such as diuretics and bowel preps can also alter fluid balance. Right, so fluid imbalances are commonly associated with electrolyte imbalance. We said if you have fluid imbalance, you more than likely are going to have electrolyte imbalances, especially sodium. Water follows sodium. So there are two different types of imbalances with fluids. Real quick, you have fluid volume deficit, where you don't have enough fluid in the body. It could be from vomiting or bleeding or insufficient, not drinking enough water, or fluid shifts going, outside the vascular system into the interstitial space, or interstitial to the vascular, and it's not balanced, it's not equal, right? So how do we know that we have fluid volume deficit? How do we check that? You're going to check labs, and that will show increased hematocrit, concentrated, right? Because if you don't have enough fluid, the blood is concentrated. So you're going to have increased hematocrit, increased BUN and serum osmolality, increased concentration, right? Increase the concentration of solutes, increased urine specific gravity. So everything is going to be concentrated. These are the signs and symptoms that you're going to see, the clinical manifestations. You're going to see tachycardia, hypotension. You're going to see oliguria because you don't have enough blood volume in your vascular system. So you're going to have hypotension, oliguria, not enough peeing, concentrated urine, decreased skin turgor. Why? Because the patient is dehydrated. Dry mucous membrane because the cells are shrinking, right? So now, hypervolemia, volume excess, is the opposite. Basically, heart failure, liver cirrhosis, long-term steroid use, high sodium intake can also cause fluid volume excess because water follows salt. So, before we eat the Big Mac with, tons of French fries loaded with salt, think of the volume that we're pulling in. Okay, so lab profile, what does it look like? Everything is going to be dilute. Decreased hematocrit in the blood, decreased BUN and serum osmolality. You're going to have decreased albumin too, because now more than likely it's the low albumin causing the fluid volume excess. What clinical manifestations are you going to see? You're going to see ascites, swelling and fluid in the abdominal area. Pitting edema, that means you're going to press on the legs and stuff, and you're going to, on the edema, and it's going to be pitting. That means it stays dented, right? Distended jugular veins, crackles in the lungs, rapid bounding pulse. You're basically just wet everywhere. Now, these are the core rules to remember. Water follows solute, low solute to high solute. Water will go in the direction of low concentration to high concentration. Hydrostatic pressure pushes out. That's what we need in our capillary spaces. Oncotic pressure pulls in. That's what we need in the venous system. We need to pull it back in to send to the heart. Balance maintains health. Imbalance leads to disease. You don't want too much or too less. You want to push out enough and pull in enough, right? And how it works is through capillary fluid exchange. So please print this out or save it and review it. Fluid regulation, let's talk just briefly about regulating fluid volume. Fluid balance, we already kind of talked about that. It's fluid balance depends on proper regulation by the kidneys, hormones, thirst mechanisms. Disruptions in these can lead to dehydration, edema, or electrolyte abnormalities. The kidneys are continuously monitoring fluid status and adjusting urine production to maintain this balance. These are the guardians of fluid volume. That means basically they maintain it and regulate it. Your hypothalamus is the sensor. It senses increased plasma osmolality or decreased volume and triggers the thirst mechanism or releases the antidiuretic hormones. So if there's not enough fluid, then it's going to make you thirsty. And if it's a lot of fluid, then it's going to make you pee. Okay? The adrenal cortex is the hormone factory. It basically secretes aldosterone, which is a mineralocorticoid. It drives potent sodium retention and potassium excretion. Key rule: where sodium goes, water follows. Remember that. The kidneys are the filtration engine. The primary regulatory organs. Response to ADH and aldosterone, that's secreted by the adrenal cortex, and it adjusts the urine volume accordingly and its compensation, basically filtering 1.5 liters of urine daily to maintain balance. Now, another thing we need to talk about when we talk about regulation of fluid is where does this fluid stay? First spacing is just balanced fluid movement between compartments, maintaining normal function. It helps to maintain function. Fluid needs to be in balance and where it's supposed to be in order to function, for the body to function. Okay. Second spacing occurs when fluid accumulates in the interstitial spaces, causing edema. Third spacing occurs when fluid becomes trapped in areas where it cannot easily return to circulation. Now, when it's in the second spacing, in the interstitial spaces, we can give some patient albumin, administer albumin, and it will help increase oncotic pressure inside your vessels and pull the fluid back out of the interstitial spaces. But when fluid starts to get trapped in areas where it cannot be easily returned to circulation, such as when a patient has burns or they have ascites in the abdominal area, right? We can't just easily pull it. It can't be easily pulled back into the vascular system, right? So this is called third spacing. This can lead to severe fluid deficits because why? The fluid is trapped in places where it's not going to help, right? We need the fluid where it's going to help, right? Even the total body water will appear as increased because the person will be swollen, but there's not enough volume in the vascular system. That is third spacing. This is a quick cheat sheet about regulation of fluid volumes. Please review it. And always remember, fluid balance in the body is maintained through a careful balance of intake, use, and excretion. On average, a healthy adult requires about 2 to 3 liters of fluid per day to maintain this balance. Fluid intake comes primarily from oral fluids, but it also includes water obtained from food and metabolic processes within the body. Output occurs through several pathways, including urine, GI tract, and losses through the skin and lungs. These losses from the skin and lungs are known as insensible losses. They occur through invisible vaporization and play an important role in regulating body temperature, like when you sweat, right? Or when you breathe, you're losing fluid. But we can't just measure it. We can't, it's difficult, not able to measure these insensible losses. The body also regulates fluid balance through the thirst mechanism and the hormones that it releases. For example, ADH hormone, right? So when plasma osmolality increases or blood volume decreases, osmoreceptors stimulate the thirst and trigger the release of ADH. ADH then acts on the kidneys to increase water absorption. Basically, the kidneys, when antidiuretic hormone means anti-diarrhea. Don't let it go. Keep it in. That's what it basically means, right? So the kidneys are going to hold the fluid in, right? Patients who are unable to recognize or respond to thirst are at a higher risk for fluid imbalance. So if my thirst mechanism isn't working, I am at a higher risk for getting dehydrated, such as the geriatric population. The kidneys serve as a primary regulator of fluid and electrolyte balance. They adjust urine volume and excrete electrolytes to maintain blood volume, osmolality, and acid-base balances. Hormones also play a critical role in fluid regulation. Aldosterone increases sodium absorption in the kidneys because water follows sodium. So this leads to an increased fluid volume. The renin-angiotensin-aldosterone system, or the RAS system, is activated when blood volume or sodium levels are low. So this works to help restore fluid volume. In contrast, the natriuretic peptides such as ANP and BNP promote excretion of sodium and water, helping to decrease the blood volume and blood pressure. So when the blood pressure is increased, then ANP and BNP help promote excreted. Other systems also influence your fluid volume balance, basically, such as your GI tract. It reabsorbs most of the fluid it processes, but conditions like vomiting, diarrhea can lead to significant losses. Additionally, the body's stress response can increase hormone release, which can further impact impact fluid and electrolyte imbalances. That's why they say stress is not a good thing, right? Okay, so remember, when it comes to fluid and electrolyte balance, the kidneys are doing a lot of the work behind the scenes. So yes, you've got to be kidding me. Okay, and that is it for our lecture on fluid and electrolyte imbalances.